In an age of powerful technology, regrettably, there are two types of healthcare. In one world, we're doing amazing things and people are living longer than ever before. And sadly, in the other world, we're leaving some people behind.
Well, one of the biggest problems with modern medicine is getting basic science discoveries converted into clinical practice, and making sure that practice is disseminated across the population is a real problem.
When I tell people that suicide is the leading cause of death for Australians aged between 15 and 44, they're absolutely surprised. It's actually 3,000 people a year. When it sinks in, they realise we do have substantial problems that have to be solved in mental health in Australia now.
So more children these days are living with a chronic and complex condition because of the fantastic advances we've made with medical science.
So they're going to live with these conditions for their whole life, and their families will as well, and that creates a lot of pressure on the family unit.
So one of the key challenges for Sphere is the indigenous health of the communities, and especially around our children. So for indigenous children, there are a number of key health issues that they're confronted with every day.
Solving today's health challenges requires extraordinary levels of collaboration and of partnership, where the strengths of many are combined to come up with the very best solutions. That's why we created Sphere, so that we could go to the next level of delivery of healthcare.
Sphere brings together groups from hospitals, care organisations, universities, and the community together to try and solve world problems.
We've got a number of LHDs, local health districts, the southeast and southwest. We've got the Sydney Children's Hospital Network. We have leaders in research like the University of New South Wales, the Victor Chang, the Black Dog Institute, Neura, and so on.
We've been gifted an Indigenous name from the elders, and I'll try and pronounce it. It's Maridulu Budyari Gumal,
which means working together to promote better health. We will learn from them as they will learn from us.
I believe that Sphere's partners are setting the standard in healthcare, not only in Australia, but around the world.
So one of the aims of the Kirby is to see if we can eradicate hepatitis C from the population in general, and one of the priority populations is to work with Justice Health to see if we can eradicate transmission of hepatitis C within the prison system.
We have developed a new initiative for suicide prevention. It's quite innovative in that it's bringing together both a community response and a healthcare response. And we're reaching 850,000 people in our first iteration of this across New South Wales and Australia. And we think it'll be a global initiative.
We're working to empower the families of children with complex and chronic conditions to build close relationships across the health services.
We're bringing clinicians, researchers, educators and most importantly our families together to make sure that no matter where a child is, that they're getting the right care at the right time, the right place.
To look critically at what are some key areas for us to focus on. So things like the impact of breastfeeding, looking specifically at their developmental skills, so that we give them the skills and capabilities when they hit school, that they're in a great position to take on board the education that they need.
Working together in that way, we can do things that other organisations can't, and we can make sure that no one is left behind in the healthcare, research, education, clinical delivery and innovation that we have planned in delivering Sphere.